In a natural menstrual cycle, every month that a woman ovulates, meaning she releases an egg, she produces a hormone. That hormone is called follicle-stimulating hormone. When you hear reproductive endocrinologists use the term follicle, think egg. And every single month when a woman ovulates, that hormone gets one egg to be released. That's how it's ovulated. But that egg comes from a small group of eggs that have the capacity to ovulate. So each month there's a small group. Her FSH gets one to be ovulated. And all the others in that group will die off. With IVF, we're supplementing her FSH so that we're just rescuing the eggs that she's losing in that month.
During the ovarian stimulation process, what we're doing is essentially using injectable medication that is a synthetic form of the hormones the brain is typically making to get the ovary to grow one egg during your normal menstrual cycle. I always tell patients that in essence, we're giving the ovary extra food so it can grow multiple eggs at one time. This happens over the course of, on average, 8 to 10 days. During that time, you're taking this injectable medication once or twice a day, coming in every couple days for blood work and ultrasound visits, so we can monitor how are the follicles growing, how big are they, and how much estrogen are they making. This is kind of what I think of as the most intense time of the IVF cycle, but it's very short, about a week and a half.
2 medications are involved in most IVF centers anywhere across the world. One of the medications is designed to stimulate the ovaries to make eggs, and the second medication is designed to stop the ovaries from releasing the eggs prior to the harvest procedure. An egg retrieval procedure typically takes about 10 or 15 minutes and is an outpatient procedure. There are no incisions involved in an egg retrieval procedure.
And we get access by using a small needle going into the ovaries while you're asleep. You can be having a lovely dream about some nice vacation spot without having to wait in any airport lines. And then it takes about 20 minutes. So we do call it surgery, and there are some risks, like with any surgery, but it's a very minor surgery. 20 minutes later, you wake up and we've gotten the eggs.
What happens in nature is that the sperm and the egg meet in the tube and fertilization occurs there, and it does because that's a very unique place. The fallopian tube makes a fluid that nourishes the sperm, the egg, and the embryo. It also has a certain percentage of gases, temperature, humidity, everything that's needed for a successful fertilization. So in the in vitro fertilization laboratory, all those things are in place in the incubator. So what we have to do is we have to get the eggs, we have to get the sperm, we have to put them in an ideal, although artificial condition, to be able to have adequate fertilization, grow the embryos, and be able to put an embryo back in you for a successful pregnancy.
ICSI is a procedure where one sperm is injected into a single egg. And it was really designed for people with very severe male factor, so men who have fewer than 1 million sperm. Even if they have thousands of sperm, they're not going to penetrate the shell of the egg unless one sperm is taken and injected into the egg. This differs from conventional IVF, where 50,000 sperm surround each egg and then penetrate the shell on their own.
For some patients, 5 days later, a fresh embryo transfer is performed, which is an outpatient procedure which just takes a moment or two, in which you're totally awake. For some patients, a different plan is made in which all embryos are frozen. When embryos are frozen, they can be tested prior to freezing to perform extra DNA studies for genes or chromosomes.
So we take those cells, we freeze the embryo, and we send those cells off to a specialty lab, and they will tell us whether that embryo has the right number of chromosomes. If it has too many or too few, it's called an aneuploid embryo. So this is testing for aneuploid. We can also use this to test for certain diseases that a person may be a carrier of, or maybe partner and our patients are carriers, and we want to make sure that person's not affected. So we can actually do probes to find out if there's a disorder such as cystic fibrosis, sickle cell disease.
Now, I know you've talked to your friends and family, and you've probably even read online about people who've transferred lots of embryos and still just managed to have their one baby. But times have really changed, and especially if you're at a good clinic that has a good laboratory that takes good care of your embryos, you do not need a lot of embryos put back in your uterus if the embryo is healthy and your uterus is healthy. And actually, it's much better for you to put one embryo back at a time. So it's my job as a physician to advise you on the proper number of embryos to transfer back. And we do this by looking at all of our data, looking at your specific case, looking at your dreams and hopes for the future, and what is the best way to give you the family you've always hoped for.
Once we have the transfer process, the hardest part is you got to wait 9 days, because that's how long it takes for us to know whether you're pregnant or not.
And any surplus embryos that have been created from this process are frozen. The ability of those embryos to implant into her uterus will always reflect her present age, not her future age as the potential recipient of those embryos. So with IVF, we're treating infertility and we're preserving future fertility. And we're monitoring how the gametes, meaning the eggs from the female partner and the sperm from the male, are interacting, so we can help this couple at a very sophisticated level overcome their infertility.
Many times this all happens in 1 month. Really from the very beginning till you know if you're pregnant might be a little bit longer than a month depending on the protocol we use. But 1 month of actual treatment.
There are over 8 million babies born from IVF worldwide. It's certainly something not to be afraid of, and certainly something I encourage you to discuss with your doctor whether IVF may be right for you.